Our topic is about black fungus, another name of it, mucormycosis. What is black fungus infection or mucormycosis? Black fungus, also known as mucormycosis, is a rare but dangerous infection. Black fungus is caused by getting into contact with fungus spores in the environment. It can also form in the skin after the fungus enters through a cut, scrape, burn, or another type of skin trauma. Fungi live in the environment, particularly in soil and decaying organic matter such as leaves, compost piles, rotten wood, and so on. It should be noted that this rare fungal infection affects persons who have health issues or who use drugs that weaken the body's ability to fight the infections. Black fungus causes. Mucormycetes are a type of mold that causes fungal infections. This mold can be found everywhere in the environment, including soil, air, and food. They enter the body via the nose, mouth, or eyes and can have an impact on the brain if it is not treated on time. According to medical experts, the main cause of black fungus is steroid misuse during COVID treatment. Black fungus primarily affects people who have health problems or who take medications that reduce the body's ability to fight germs and illness. The person's immunity is low after COVID treatment, which makes them vulnerable to black fungus infection. People with diabetes and COVID-19 patients are at greater risk of developing an infection.
تختلف أعراض الفطر الأسود حسب العدوى، وقد تكون عدوى في الجيوب الأنفية والدماغ تسمى حينها بالعدوى الأنفية الدماغية. فقد تبدأ بعدوى في الجيوب الأنفية ثم تؤدي إلى تورم الأعصاب التي تخرج من الدماغ، وقد يتسبب أيضا في حدوث جلطات دموية تسد الأوعية الدموية إلى الدماغ. وقد تكون العدوى رئوية تسمى حينها بفطار الغشاء المخاطي الرئوي. يزداد الالتهاب الرئوي بسرعة وقد ينتشر إلى تجويف الصدر والقلب والدماغ. وأيضا قد تكون العدوى في أجزاء أخرى من الجسم مثل فطار الغشاء المخاطي في الجهاز الهضمي والجلد والكلى. الأعراض تشمل أعراض الفطر الأسود الأنفي الدماغي: انتفاخ وبروز العينين، قشور داكنة في تجاويف الأنف، حمى، صداع، تغيير الحالة العقلية، احمرار الجلد فوق الجيوب الأنفية، وأيضا ألم الجيوب الأنفية أو احتقانها. أما أعراض الفطر الأسود الرئوي فتشمل: أولا سعال، 2 سعال دموي في بعض الأحيان، 3 حمى، 4 ضيق في التنفس. وأعراض الفطر الأسود المعدي أو المعوي فتشمل وجع بطن، دم في البراز، إسهال، وأحيانا تقيؤ الدم. وأعراض الفطر الأسود في الكلى أو الكلوي فتشمل حمى، ألم في الجزء العلوي من البطن أو الظهر. وتشمل أعراض الفطر الأسود الجلدي منطقة واحدة تكون مؤلمة أحيانا وتكون متيبسة، وقد يكون مركزها أسود اللون.
علامات توی بزن و أعراض توی ديار بنبوما كوما كأعراض بيدات فيريكا في فطرة بيجني فطر الأسود أو شي هناك علامات الديارن الدف هر کسی که افنا ساخیا لی پیداد بید وکیو فیور حما یک بود چید بود تا ام بینیم کردیم هر وصا كالس كوخكينا كون سؤالك زيدا بوتشيز بيتو هروسا گلک بهن کرتیک لی پیداد بید حتی دبین تندک علامات سر رخکی سروچاوت وی پیداد بین کو خاص چاوکی آن دفنکوی هندک تخمید رشت کفنه سر ایشانجی پیداد بید هر وصا السري هتكون دفناوي on دافي داخلي دافي بنية رشت كافنير وهر وصا درابون وتقيؤ شربت هر وصا الجهاز هضمي دا جالك نزيف بو بيداد بيت وخين داد كافيت حتى الجال بيساتياوي هر وصا هندك حالات إسهالك حالة كو مثلا أبا حما يعني حما كزيدة بوچيد بيت سر ایشان پیدا بید حتی کخکین و بین تنگیه که پیدا بید وکی اوی برادرین که اوه هولیاتی ها اوه هنه مثلا بوما دیاد بید که اوه فطر الاسود خاصة الولات که پیدا بید الولات هنده گل ریز و سپاسید ما بو همه هوالو برادرین ما
How black fungus affects COVID patients. Mucormycosis is a rare but serious fungal infection, while the cases of these infections were relatively less. But with the COVID-19 outbreak, because the patients have the low immune systems, it gave a boost to the spread of this infection. It is commonly known as a black fungus and spreading very, very much. The infection is now detected among COVID-19 patients mostly, and then they first started in India region, and now it's spread in different parts of the world with a significant increase in fungal infection. And the government, they all mandated for all the states to report suspected and confirmed cases of the fungal when they see it in COVID-19 patient. As infection, we said, is rare, but once person is infected, the fungus manifests in the skin or can affect the brains or lung. Many cases of this infection have been reported in COVID-19 patients. Why is it occurring in COVID-19 patients? Mucormycosis can occur after COVID-19 infections, whether during the hospital stay or a week after discharge, because the COVID-19 generates a sudden change in the interior environment of the host for the fungus, because the fungus need a weak host so it can separate and make its disease and its infections, and to replicate the medical treatment administered unknowingly promotes fungal developments. COVID-19 causes harm to the airways, mucosa, and blood vessels. It also causes a rise in serum iron, which is required for the fungus to grow. Broad-spectrum antibiotics not only kill potentially harmful bacteria, but also beneficial common cells, although antifungals such as voriconazole prevent aspergillosis and many different fungal diseases.
How to block fungus treatment? We have another method to treatment this disease. Mucormycosis treatment must be fast and aggressive. The concern is due to the fact and by the time even. Okay, must be diagnosis this disease fastly, and most patients will need a surgical or medical treatment. Most infection disease must be done by the surgical or also medical treatment. Medicines play an important role in the treatment. There are many type of medicine used in to treat this disease. Black fungus prevention. How to prevent this disease? Preventive measures to follow another thing is all instrument or humidifier must be clean or replacement for the patient. and the humidifier bottle should be sterilized. It means all instrument it is must be sterilized and cleaning when used with the patient. Also masks must be used always, and also if you have recovered from COVID, it is critical to wear masks to prevent the infections. Also must be used a critical method to prevent the spread of this disease because it is very dangerous. Also another point, who have a diabetic disease must be control the level of the glucose, because the diabetic disease or high level of blood glucose cause the spread or develop this